Hello and welcome to today's episode of the Boston BioLife Innovation Series for the 2023 Healing Future Health Summit. Today we have the pleasure of speaking with Lizellen La Follette, that is a globally recognized board-certified OBGYN specialist, leader and educator and researcher focused on comprehensive health care for women, and she'll be discussing the role of longevity science in improving outcomes for patients that wish to increase their probability of having a child. So, Dr. La Follette, thank you so much for being here with us, and we look forward to learning about what you're doing and why you're interested in attending the Healing Future Health Summit.
I'm delighted to be here, and thank you. So one of my big issues and research interests has to do with the combination of how do I help patients in their journey towards having a family on the one hand, and where is the basic science and innovation related to fertility. One of the big problems in general about longevity is that the ovary gives us a sort of a heads up ahead of time, namely ovarian function decreases before other organ systems decrease. So well within a woman's body, we are able to see that ovarian decline precedes aging by about 30 to 40 years, and that many women will spend half of their lives post-menopause, so namely after ovarian function has ceased. So do we understand the human ovary as an insight in terms of longevity? And the answer is we're starting. And can we influence how we advise younger women who want to pursue fertility safely without necessarily a lot of intervention? And that answer is maybe.
Well, I think this becomes more of an important topic as our lives become busier and women are having babies later in life. So the science of fertility obviously needs to evolve. And I think that, we're probably more challenged now than ever in our reproductive science. You think that's a fair statement?
I think it's not only fair, but I think it actually underlines the most important question about why do some people fail in their ability to conceive. We know that that answer is probably decreased ovarian function, but is it decreased egg function? Is it decreased extracellular matrix of the ovarian environment function? Is it both? How can we influence? Is there a way to easily influence some? All of these are important. I think the delayed childbearing as a reproductive choice is so important because if you think about women's careers over time, it would be nice to be able to go to your OBGYN and say, look, I'm about to get a promotion at my job. I'd rather not be pregnant right now, but do I have time to wait? We really don't have good answers to that. And this bypassing of this question in the promotion, in my mind, erroneous promotion of egg freezing doesn't really help women because the technology is not there to end up being able to thaw eggs, fertilize them down the line, and end up with a live born child. So we really don't have a way to say, let's just put the brakes on and give you a different window yet.
And are you finding that, like other areas of medicine, that the effect of epigenetics is having more of a difficult influence on people having the ability to conceive a child?
Yes, I would say that the pandemic has been very bad in terms of lifestyle, that women, the population in general has gotten heavier. I think obesity is one of the big problems we have in general in terms of being able to preserve function. I think diabetes, as its exponential curve, some statistic I saw is somewhere between 20 to 30% of women may be diabetic at this point, linked obviously in many instances to obesity, clearly influences the ability to conceive. And I think that we need to understand that our entire metabolic system is influenced. The lack of exercise and the lack of taking good care in terms of weight clearly is a detriment to trying to conceive.
Well, the news can't be all bad. I'm sure there's some encouraging things that science brings to the table when it comes to helping perhaps women have babies later in life, perhaps more complicated pregnancies now being more viable. What would you say about that?
Yes, I would say once women are pregnant, we are getting better and better at handling these high-risk pregnancies, whether it's diabetes, whether it's hypertension, whether it is multiples. All of those, I think, we're getting better and better at being able to treat. I feel that my message to my young patients or older patients, anyone that wants to try to conceive for that matter, is get your health in order. That's going to go the longest way. And we'll try to help on terms of all the other stuff. But you being healthy to begin with, watching your blood pressure, watching your weight, staying active will help the outcome of the pregnancy. And so that's a very positive message from the perspective you can, as the patient, as the preconception conversation, influence the outcome by taking care of yourself.
And the research that you're working on right now is focused on looking for biomarkers, correct? That maybe give the patient an indication of how viable or how probable or likely it might be for them to conceive?
Yes, I think that we do not amazingly have very good biomarkers that are reliably predicting fertility. We thought we did, or we used some, but a recent study summarized in The Economist in January of 23 shows that the markers that we have really do not predict fertility and pregnancy for that matter. So that sort of throws that out the door. So we have to go back to the drawing board to say, well, should we even use something that's not very predictable for fertility? Because it can only be a detriment if those numbers are off in terms of the psychological environment of the patient and the family in terms of conception. So I think that we have to be very judicious in how we advise people of predicting what is their fertility and be educated about the fact that we need more information and more data and more research to be able to say, gee, we can actually take a snapshot of your ovary and tell you, yep, you got a bunch of follicles, you'll be okay.
Well, I think it's amazing the work that you're doing, and thank you very much for shining a light on such an important topic and really combining a lot of the assets that the longevity and anti-aging and health and wellness science bring. And I think you've opened some doors for some other scientific collaborations and research. So I think this is a very important area. It's an area that's not covered very often. And I think it's something that affects everybody directly, as a matter of
Absolutely.
fact. So thank you so much for your time. I really appreciate you sharing with us your information and your wealth of knowledge. And we look forward to your presentation at the upcoming Healing Summit.
It's my great pleasure. And thank you for having me.